Hello and welcome to the video demonstration of submitting a PA for Enteral nutrition products. The purpose of this video demonstration is to inform pharmacy providers and prescribers of the submission requirements for the Enteral nutrition prior authorization request form. All Enteral nutrition product claims will deny for reject code 75, as all Enteral nutrition product claims require a PA, with the exception of claims for members who are younger than 21 years of age when prescribed by a physician or certified nurse practitioner who has CCS panel authority. Claims will also deny for reject code 76 if the quantity requested for the product exceeds a maximum daily calorie limit or if the requested day supply exceeds 31 days. Daily caloric requirements will be assessed during the PA request review. The maximum daily caloric limits are based on feeding status, age, and product category or type as follows. Tube fed, up to 2,000 calories per day for all products except infant products. Orally fed in 22 years of age and older, up to 1,200 calories per day. Orally fed in 21 years of age and younger, up to 1,000 calories per day. And for infant products and members younger than 1 year of age, up to 800 calories per day, regardless of feeding status. To begin this video demonstration, let's review the steps through the role of a prescriber, Dr. Smith. Dr. Smith would like to prescribe Ensure Plus 1.5 cal strawberry flavor 237 mLs. Dr. Smith will begin by reviewing the list of contracted enteral nutrition products. Only products on this established Medi-Cal list are covered. The claim will deny with reject code 70, product service not covered, if the product's NDC is not on the list of contracted enteral nutrition products. To locate the list, she navigates to the Medi-Cal RX provider portal homepage. From here, she selects the Forms and Information tab found on the left-hand side of the page. Then selects the Covered Products List tab, also found on the left-hand side of the page. She scrolls down to the other list of covered products and selects Contracted Enteral Nutrition Products. When selecting the link, in most cases, the Excel sheet will automatically download to your computer, and to continue, open the downloaded item. In other cases similar to this example, the Excel sheet will open as a new page in your browser. There are two tabs at the bottom of the spreadsheet, the Contracted List and the Deletions List. The contracted list contains enteral nutrition products eligible for coverage and reimbursement. The deletions list contains enteral nutrition products that are no longer reimbursable and the effective date of deletion. Dr. Smith makes sure she is on the contracted list tab. To streamline searching for the requested NDC, she selects Ctrl F on her keyboard, which allows her to search more efficiently. Dr. Smith enters in the requested NDC and selects Find All to search the document. Unfortunately, the NDC could not be found. Therefore, Dr. Smith will need to select a therapeutic equivalent from the list to prescribe. Dr. Smith reviews the list of eligible NDC-specific products and determines that Ensure Plus chocolate 8-ounce bottle is a medically appropriate alternative. Now that Dr. Smith has selected a product eligible for coverage, she will need to submit a PA. As a reminder, all enteral nutrition products require a PA with the exception of claims for members who are younger than 21 years of age when prescribed by a physician or a certified nurse practitioner who has CCS panel authority. First, she verifies that the 3 prescription requirements are met. 1. Ensure that the requested product is covered and that the product will be dispensed by a pharmacy provider. Dr. Smith just confirmed that the requested product is on the list and a pharmacy will be dispensing the product to the member, so she has met this requirement. Number 2, ensure that her written or electronic prescription is signed by the prescriber, as this is required for authorization of all enteral nutrition products. Dr. Smith has confirmed that she signed the prescription for the product and therefore has met this requirement. Number 3, ensure that the prescriber's full name, address, and telephone number is clearly supplied, if not pre-printed on the prescription form. Dr. Smith has included her full name, address, and telephone number on the prescription form, so this requirement is also met. Now that Dr. Smith has ensured prescription requirements are met, she is ready to work on the PA request with the focus on verifying billing requirements and limitations. Dr. Smith has chosen to complete the PA using an approved fax form, which can be found on the Medi-Cal Rx provider portal. The PA form can be found on the Forms and Information page under the Prior Authorization section. She has already filled in the member's information, including height and weight, which is optional, and the prescriber information. Next, she will fill out medication information to ensure billing restrictions and limitations are met. She includes the product name, Ensure Plus chocolate 8-ounce bottle, and NDC, and the dose, strength, and frequency. She also ensures that the quantity requested meets the member's daily caloric requirements and does not exceed a 31-day supply. The member's daily caloric requirement is 1,100 and therefore 34,100 calories per 31-day supply. The requested product is Ensure and it has a caloric density of 1.5 kcal per ml. 34,100 calories divided by 1.5 kcal per ml is equal to 22,733 mLs per 31-day supply. This product has the maximum quantity of 41,475 mLs per 31-day supply as listed on the list of contracted enteral nutrition products. 22,733 ml per 31-day supply does not exceed 41,475 mLs and is within the quantity limits. Dr. Smith is prescribing 3 bottles, 237 mLs each per day. 237 mLs multiplied by 3 multiplied by 31 equals 22,041 mLs, which also does not exceed the 41,475 ml limit. Please note that quantities should be rounded up to the smallest available package size. Rounding up does not include rounding up to 6 packs or full cases of product. This Ensure product comes in 8-ounce bottles and has 24 bottles per case. The request can be billed as 96 bottles per 31-day supply. It can also be billed as 4 cases. Now that Dr. Smith has ensured billing requirements and limitations, she can focus on verifying that she includes the required information to meet the PA documentation requirements for this request. First, the medical diagnosis code related to the product requested. Dr. Smith has entered in an ICD-10 code in the diagnosis section of the PA form, unspecified dysphagia. Therefore, this requirement is met. Next, the required clinical information. Dr. Smith provides an explanation for medical necessity, which in this case, the member is unable to meet caloric needs with dietary adjustments. Next, will the patient need multiple flavors of this product? If the patient needs multiple flavors of this product, you will check yes. If multiple flavors are not needed, you should check no. A second PA request is not needed for multiple flavors if the products are within the same product category and type. Next, the route of administration, for example, orally fed or tube fed. Dr. Smith has included the route of administration documenting that the patient is orally fed. Therefore, this requirement is met. The patient's daily caloric requirements. Dr. Smith has included the patient's daily caloric requirements on the PA form. This information, along with other medical measurements and labs, must be dated within 365 days of the request, except for specialty infant products, which must be dated within 120 days of the request. It is dated within 12 months of the request, and therefore, this requirement is met. Finally, the 11-digit product NDC. Dr. Smith previously included the 11-digit product NDC in the notes section, and therefore, this requirement is met. Now that Dr. Smith has ensured that all prescription requirements, billing requirements, and limitations and documentation requirements are met, she ensures that the form is properly signed and dated and faxes her PA to Medi-Cal Rx. She knows that if she has any questions or concerns, she can reach out to the Medi-Cal Rx Customer Service Center at 1-800-977-2273, which is available 24 hours a day, 7 days a week, and 365 days per year. And this concludes our video demonstration of submitting a PA for enteral nutrition products.